And as promised, this is Congressman Joe Sestak with us on WILK. Joe, welcome to the show.
Sue, thanks for having me on and on such an important topic. Thank you.
And I know that you actually, before you got involved with running for the United States Senate, you had already crafted a plan that you thought might work, and I want you to go over that. But let me ask you, first of all, you were on our show a couple weeks ago, and you were not a declared candidate at that point. Joe, what made you decide that now is the time, and yes, you were going to do this run for United States Senate? What was the deciding factor in your mind?
It was the trip around the 67 counties. I saw working families that Washington, D.C. had forgotten. And frankly, I think on the one hand, Washington, D.C. has to be held accountable. Those who were stewards that sent us into the shoal water where we went aground in this savage recession, in a healthcare system that has had 10 million Americans lose their health care since 1995. But second, I honestly believe we need leadership, principled leadership, where principle triumphs over politics in order to have Pennsylvania be all it can be in the next 30 years. Pure and simple. It was seeing the working families and how savage they have been by this recession.
Okay, well, that's a pretty strong statement, Joe. You are part of the Washington establishment, though, are you not?
Well, you know, I spent 31 years in the U.S. military, and I was glad to lead men and women into a war in Afghanistan. I was head of the Navy's anti-terrorism unit, and I did serve for President Clinton in Washington, D.C. in the mid-'90s, where I saw us from Washington give peace and prosperity to this world as I was his director of defense policy. But you're right. About 2.5, 3 years ago, my daughter had a brain tumor, 4 years old, and I left the military and ran for Congress to pay back everyone who gave us a wonderful health care plan in the military, TRICARE, that saved her life. She's 8 today. So you're right. For 2 years, I've been down in Washington trying to change it. And you know what? It needs a lot more change. And I believe that one senator from Pennsylvania whose vote is so important to the future of health care, our economy, creating jobs, and an education system that is no longer out of reach of those whose 401s and IRAs have been devastated. I believe that one vote can make a difference in Washington. Yep, I've tried the last 2.5 years to change it by actually having voted for and passed $1,100 in Pell Grants, so they have been increased, by actually voting to cut in half federal aid interest loans to children going to college from 6.5 to 3.4, and by actually getting out there and fighting for the health care plan that I believe we are about to talk about now.
We are about to talk about it now. How did you know?
Because I listened to that wonderful lead-in from a great question of one of the constituents I want to work for, who asked you about her or his plan, and I've forgotten who it was, at a corporation, and their fear they're going to lose it.
Right, and that's, I think, Joe, there's some fear out there. I think that the fear is real. I don't think the fear is manufactured. I mean, on both sides there may be people carrying signs that do have an agenda, but in the middle are the people who are fearful and who, quite frankly, are satisfied with their health care plans and don't want to see any kind of changing where they receive less service for more money. And I think that that's legit. So lay it on the table for us here. Lay it on the table.
Absolutely. First, Sue, I think how you expressed it was spot on. There is fear, there is anxiety out there, and I saw it in all those 67 counties. After the first 5 minutes, whether you were a Democrat or a Republican, the questions that came up to me was the health care reform. And I'm having another town hall tomorrow evening in downtown Philadelphia in order to continue to address this issue.
Now a lot of your colleagues are shying away from that, but you don't seem to be afraid to come out and address the people. I like that.
If there's ever a time for leadership, it is now. Public officials have to remember that you work for those who elected you. And yes, it's a little bit contrived, sure, but that's politics. I believe that the vast, vast majority have true anxiety because we from Washington haven't been doing an adequate job of explaining it. So first and foremost, to the question that was asked, no, if you work for a corporation right now that has a health care plan, you not only get to keep it, but we're mandating that that corporation has to continue its health care plan. The only ones that don't have to is if in the first year, which doesn't begin, by the way, to 2013, is a small business of 15 or less people. They get a choice to give one or to let their individual employees choose among any private health care plan in a new health care insurance exchange, just like a stock market. You can pick which private plan you want, or you can pick, not a mandate, you can pick if you want the public health care plan option. Now, why is that public health care plan option important? Because in Pennsylvania, two companies have 70% of all private health care plans, a duopoly. And that's why in the last 8 years, health premiums have gone up over 90% for Pennsylvanians. So by having a public health care plan option, not subsidized by the government, but by the premiums and copays of those who elect to join it, they will have actually less cost because that person who runs that public health care plan will not be a CEO being paid $23 million. Or as one recent CEO who just left here in Pennsylvania got $70 million severance pay. So we're going to begin to have competition with those two large companies in Pennsylvania that ultimately will better discipline cost. But if you're also in your health care plan today, you're even going to eventually pay less. Why? Well, we're mandating that if you're a woman and you're 40 years old, a mammogram has zero copayments. Zero copayments for any preventive exam or screening because we want to catch an illness like cancer early. Not only is your health better, but we pay less if we catch it early. That's the types of benefits in this system we've passed out of my health committee.
Okay, so you've actually worked on, I know there are several in play, Joe, you've actually worked on one of them, which is good to hear because a lot of people talk about them, but they haven't really worked on any of them.
No, I purposely went to Congress and got on the Health, Employment, Labor, and Pension Subcommittee so that the whole piece of the bill would have to come through my committee, which meant I could work on it. So we'd have weekly meetings among the Congress members of my committee. Well, sometimes it'd be every 2 weeks, but my staff and I would be continuous to work on it. And what I proposed, which is sort of like an outline of the Massachusetts health care plan, where competition, but fairness and transparency in that competition will best discipline cost, is what I proposed, and that is the essence of what is actually in this bill. And that's why I'm an opponent of it. It's what I got into Congress to work on.
Now, Joe, we've talked, and I know there's different kinds of these health savings accounts, health savings plans. I have heard talk that some of these will be abolished. I think that would be an egregious error because I think
I agree. I think if somebody wants an HSA over and above, what the others, they can have it. All right, but here's what we also are mandating, however. So you can still have a choice to have an HSA where you put extra money in, but what we are mandating, and by the way, the HSAs as they are, it's mandated they can stay around until at least 2018. Then a decision needs to be made. Here's the decision that needs to be made. We want everyone to be in a plan that meets minimal benefit requirements, which is the preventive care requirements that I outlined, a bone density exam, a glaucoma exam, exams for blood pressure. And we want all those copays to be free because if we have people that aren't coming in for preventive care and they choose not to, then we will pay more. Second, we are mandating that everybody must be in such a plan. Why? Well, 1/5 of this 47 million uninsured are people, usually single people around their 30s, who earn $50,000 and more, very healthy, so they think they're going to be masters of the universe and live forever, so they only go in for health care when they get very sick. And you know where they go? The emergency room. All the uninsured go to the emergency room. And then the hospital passes that cost off to the insurance companies as overhead that you and I, Sue, pay for. We, on average, as individuals, pay $400 more today for our private health care plan than we would if there weren't any uninsured. It's why everybody has to have car insurance. If you and I get hit, we want the other guy to be able to pay us for our repair of our car. Well, it's the same way now. The uninsured are being paid for by us anyway. Bring them into the system, mandate they must be in it. We'll subsidize enough up to a certain amount of the less poor, of the more poor, but the more that can, the ones that can't afford it have to pay for it. Why? It's unfair that we pay for them when they go to the emergency room when they can afford it. Second, for those that are uninsured and can't quite afford it, you and I pay for it anyway. If we bring them in, get them early care, preventive care, early diagnosis of disease, we eventually bend down the cost curve of health premiums that have gone up 200% since 1995.
All right,
that's the economic argument, the pocketbook argument of why I'm for covering people in health care.
Now, I have one more question that was given to me by one of the callers that couldn't make the show, who has a concern about you missing an extraordinary amount of votes since the beginning of the year. This person claims you missed 109 votes, Joe, and they were wondering why you can't be present more often to vote on things.
Well, you know, my first 2 years I had a 97% record. It was about well above average, and overall it's 93%. And what the gentleman or gentlewoman gave you is that I did in June and July go through those 67 counties because I wanted people to know who I was and listen to them before I got in the race. And I honestly felt that if Arlen had been out there listening to the people, he wouldn't have given 2,000 of his votes with President Bush. That's the vote I'm working so hard to replace. But, Sue, also, do you know that I'm the only congressman that keeps his office and his district open 7 days a week? In the first 2 years, we handled 10,000 constituency cases. That's 3 times any other congressional office.
All right, you know
I've already passed more pieces of legislation this year than Arlen Specter.
Well,
more bills.
Hey,
and so we are working
yeah.
so hard in order to change his vote because, heavens forbid, look where it got us.
All right, Joe, I have to cut you loose, but I know we'll talk again, right?
Sue, thanks for that question. It gave me a chance because I know misinformation's out there, and you aren't going to have a harder working senator than me. Thanks, Sue.
Thanks, Joe. Sestak running for United States Senator. It's 11:21. The break is on the horizon. You're listening on 910 in Scranton, 980 Wilkes-Barre, 1300 Hazleton, 103.1 FM.